So one of the concepts that you learn in nursing school is infection control. So I'm just going to go very briefly and very quickly through some of the basics. Contact precautions are used for pathogens that are spread by direct contact. In this case, you're going to use your PPE to prevent direct contact with the individual or with contaminated surfaces in the room. So this is where you would go into the room with your gloves and your gown and your shoe covers every time you enter the room, pretty much. There are some variations on contact precautions, but I'm not going to get into that for this because I have a different purpose for this. Droplet precautions are used for pathogens that are spread by larger respiratory droplets. So droplets are larger, they are heavy, and they fall to the ground before you get further than 6 feet away from the individual. And they are too large to pass through a surgical mask. So if you have to be closer than 6 feet to an individual and you are wearing your surgical mask, the droplets are going to be too large to enter that mask. So this is for illnesses like the flu that can live in those larger droplets, but they cannot survive in those smaller aerosolized particles. So if you are taking care of somebody who has an illness like the flu that's spread through droplets, then you as the caregiver wearing the surgical mask is going to protect you because those droplets are too large to get through. Airborne precautions are used for pathogens that are spread by the smaller respiratory particles, or those aerosolized particles that are suspended in the air. So illnesses that can survive in those smaller particles, you're going to need airborne precautions to protect you from those. So these particles are too small for a surgical mask. So as the healthcare provider, if you're wearing a surgical mask, it's not going to protect you because these tiny aerosolized particles are suspended in the air all around you. However, if you are the person who has the airborne illness, wearing a surgical mask to cover the source of escape from the respiratory system is going to be more protective. And I have an example of that. So I have some patchouli and sweet orange air freshener. And if you've ever smelled patchouli, you know how strong of a scent that is. And I have 2 surgical masks and a KN95. So the first thing that I'm going to do is to put on my surgical mask, and I'm going to mask my air freshener. So the first thing that we want to look at is when we spray the air freshener or when the air freshener coughs, wearing the mask. As you can see, even though it is an aerosolized product, it is not exiting the mask. So I literally can't smell any of it right now. So next I am going to be wearing the KN95 mask, but I do want to point out that if you're in the healthcare setting and you are wearing an N95 mask for your patients that are on airborne precautions, you have to be what they call fit tested for that mask to make sure that there are no gaps, that it's completely sealed around your mouth and nose so that there's no chance of you breathing in those aerosolized particles. With the KN95, that is not really possible. So even though it is the best protection that most people can get, it is still not as protective as being fit tested for an N95 mask in the healthcare setting. So now I'm going to spray the air freshener while I'm wearing my KN95 mask. So the air freshener is coughing. And I can't smell it. Now to try the same thing wearing my surgical mask. So as you can see, most of the particles are heavier, those heavier droplets, and they're falling to the ground. But some of them are airborne. Some of them you can see and some of them you can't, but I can definitely smell them through this mask. Not only can I smell them, I can taste them, which means that they're getting into my mouth and my nose. And lastly, myself completely unmasked, masking the source. And I can't smell that at all. So I know that at least the majority of it is being trapped inside the mask. This is not a new concept. TB, or tuberculosis, used to be a widespread illness in the world and in our country. We used to have sanatoriums set up all over the United States for people who contracted tuberculosis because it was very infectious. It was airborne. And Folks who contracted TB would have to go to the sanatoriums to live until they either died or entered a latent phase of the illness where they were no longer infectious. But because of the institution of infection prevention measures, including wearing masks, we were able to actually close the last sanatorium in the United States in 1954. So what we teach our patients now that have TB is that, of course, they have to take their medications and other treatments, but they also need to wear a mask, just a plain surgical mask, if they're going to be around anybody else to prevent spreading that infection. In fact, when we have patients that have tuberculosis in the hospital, they're kept on airborne isolation in a negative pressure room, and the healthcare providers that go into the room have to wear that fit tested N95 and all of those nice things. But if that person has to go down for some type of a test during their hospital stay, they wear a surgical mask during transport. But one of the big differences between tuberculosis and COVID-19 is that when you have an active infection of TB, you're generally very sick. You know you have it. You have night sweats, you're coughing up blood, you have a high fever, you have chills, you know that you're sick. And that's not always the case with COVID-19. Some people have mild symptoms and some people have no symptoms. So before you realize that you're infected, if you ever realize that you're infected, then in the meantime, you are spreading that illness unless you are wearing that face covering. So that's just a brief, crude explanation of why masks do and do not work in certain instances. There are, of course, multiple factors that come into play with COVID-19 and other illnesses. So stay tuned.